Thank you, sir, and good evening, everybody. I would be talking about what we do in most of the non-communicable diseases. First, advise the lifestyle changes that needs to be taken care of in such patients. So, dietary advice and physical activity and exercise plays an important role in management of any non-communicable disorder that includes the MSLD, diabetes, cardiovascular disease, and all these. So, I would be talking about first 2 points. So why lifestyle changes are important? Because once you do a lifestyle changes, reduce the weight, increase the physical activity, it improves the metabolic control. There's definite improvement in the glycemic control. Uh, Blood pressure also improves the lipid profile, and probably in many patients, either they needs pharmacological management later on, or you can reduce the medications if you implement these measures effectively. Apart from that, it improves the quality of life and maybe it prolong your lifespan. So lifestyle changes are important. This is typical Indian diet. What we consume daily has a plenty of rice or rotis, along with some little bit of a dal. That's a protein, little bit of a protein. Dal again is not again very good source of protein, and some vegetables, and most of time it is starchy vegetables like potatoes or something. On the top of that, what we have is plenty of chai, plenty of sugar along with the chai, and chai without snack is something nobody takes. So deep fried snacks. And all this is the recipe for the insulin resistance, increased lipogenesis, and the liver inflammation. And these all are the risk factor for the MSLD. Ideal diet should have carbohydrate intake 50 to 60%, fat 20 to 30%, and protein 15 to 20% of daily energy intake. Uh, Talking about carbohydrates, intake should be less than 50 to 60% as mentioned, but we should try to reduce the refined carbs or plain sugar as much as possible in these patients. Use of whole grains like the millet or brown rice is preferable because whole grain can even improve the gut microbiota. And nowadays it is shown that the improved gut microbiota can improve the metabolic health of the person. Preferred carbohydrates, non-starchy vegetables, green leafy vegetables, broccolis, cauliflowers, bell peppers, these are the preferable. Avoid starchy vegetables like the potatoes, sweet potatoes. Whole fruit should be preferable over a fruit juices, and obviously we should be avoiding candies, desserts, sugary beverages, or packaged snacks or packaged foods. Whole grains are preferable: brown rice, whole wheat flour, millets, or quinoa. Avoid white bread, white rice, maida, pastries, sugary cereals. These should be avoided. And because diet high in the fructose and sugar promotes the insulin resistance, de novo lipogenesis, increase the hepatic fat accumulation, and these all are the central to the pathophysiology of the MSLD. And as Indians, we traditionally used to consume a lot of sweets, and now we have options of lot of pastries and cakes and even other westernized, more refined carbs are available now. Replacing sugar with non-nutritive sweeteners may be helpful. But there is a caveat. It should be in the moderation because there are some studies which have shown that the non-nutritive sweetener can induce the gut dysbiosis, can cause the leaky gut syndrome, and that can cause the increase the basically systemic inflammation and can cause metabolic dysfunction. Coming to the fats, fats should ideally be less than 20 to 30% of the caloric intake. We should be preferring the unsaturated fatty acids like the MUFA or PUFAs, which are beneficial in the patients with the MSLDs. MUFA rich oils includes the olive oil and canola oil, which reduces the hepatic fat and improves the insulin sensitivity. PUFA oils and omega-3 rich oils are like the flaxseed oil and the rapeseed oils, and they are known to improve the metabolic health, also reduces the triglyceride, transaminases, and reduces the fat production in the liver. So oils rich in the MUFA or PUFA would be preferable over the regular oils. Fish and seafood are again beneficial because they have a significant amount of the omega-3 fatty acids and the PUFAs. Trans fatty acids are total no, but in the Indian cooking methods promotes the trans fatty acids when you reheat the cooking oil again and again, that increases the trans fatty acids. And again, saturated fatty acids like the ghee, coconut oil, palm oil should be limited to the minimum possible. Protein plays an important role, and it is lacking in the Indian diet. We should be having at least 15 to 20% of the daily caloric intake in the form of protein. Uh, Typical Indian diet, vegetarian diet particularly, has a very limited amount of the protein. That needs to be improved, but red and processed meat should be minimized. We can encourage the plant-based legumes or nuts and seeds. It has known to improve the hepatic function because they have significant amount of the dietary fibers, or we can use the low-fat dairy products, again, which has known to improve the hepatic dysfunction or MSLD. But ultimately, caloric restriction plays an important role whenever we are talking about type 2 diabetes or MSLD or obesity. There should be caloric restriction and macronutrient balance that is important. Daily deficit of 15 to 1000 calorie is known to reduce the hepatic inflammation, even has known to cause the remission of the diabetes. We have seen that in the various studies. So basically, weight loss is the critical factor in achieving both in the MSLD and the liver fibrosis. So negative energy balance is crucial. And this study, which has shown the 52 weeks of just lifestyle intervention and different weight loss and what are the changes. If you see 5% weight reduction, NASH resolution 10%, fibrosis regression up to the 35 to 40%, and steatosis improvement again 35%. You lose the 7% of the weight, more improvement. 10% or more weight reduction, even fibrosis can be significantly regressed if you can achieve weight loss more than 10%. So weight reduction in an obese patient plays a crucial role. Nowadays, there are several studies which suggest that the intake of coffee may be helpful in the various liver diseases, including the MSLD. Uh, we are talking about black coffee here, not Starbucks coffee, which is rich in the sugar and cream. It has known to reduce the liver fat, improve the liver enzyme, and decrease the inflammation. This positive effects are probably attributed to polyphenols. Intermittent fasting is nowadays a big fad. A more appropriate term is time restricted eating. You restrict your eating time to 6 to 8 or 9 hours in a day. Fasting in India is a very common practice, but it is more of a feasting in nowadays rather than the fasting. People just fast and basically after the ending the fast they feast, or during the fast also there are so many things they can eat. So that's more of a feasting. Typical Jain practice is of time restricted eating. Alcohol is strict no. Exercise plays an important role, and we should be encouraging the patient to increase the exercise. Uh, it can reduce the hepatic triglyceride, reduces the visceral fat, reduces the plasma triglycerides. But what if patient says, I can't do much of exercise or walk too much? Because most of the time we advise the aerobic exercise to the patients, walk or brisk walk or treadmill or all that. Patient has osteoarthritis, severe obesity, these patients can't walk. So in these patients, low impact activity, stationary bicycling, swimming, water sports can be play a role. In elderly patients, you can advise for the elastic bands or movement exercises like the hot yoga or tai chi. Any activity is better than the no activity. That is the thing. Aerobic versus resistance, again, there are a lot of talks, but even the resistance exercise is known to improve hepatic function and reduces the weight. In fact, resistance exercise causes much less cardiorespiratory stress because energy consumption in the resistance exercise is much less as compared to the aerobic exercise. For those patients who can't tolerate aerobic exercise, you can advise the resistance exercise. Daily steps count nowadays, most of the people counts their steps and it is important. And 8 to 10,000 steps in a day is a sweet spot. We should be targeting that. And in this study, considering the mortality in the patients with the MSLD, what they have seen is steps are more important. Intensity of step is not important. You just walk even leisurely 8 to 10,000 steps. That is more important than the brisk walking or whatever we are advising. So take home message, uh, control diet in the moderation, caloric restriction if the patient is obese, regular physical activity, aerobic or resistance, whatever your patient can tolerate. Even non-exercise activity thermogenesis, just I talked a leisurely day-to-day activity, you 8 to 10,000 steps, if you can make out, that is good enough. But lifestyle intervention implementation is a tough. And it is alone is less effective once the patient progresses to the liver fibrosis stage. At that time, you need other interventions, pharmacological or sometimes extreme bariatric surgery. These are difficult to maintain in the long term, and these needs behavioral and moral support for the most of the patients. Thank you.